Video is all about perineal massage. I'm Georgia, I'm a pelvic floor physiotherapist with BN Australia, and today I'm going to guide you through how to do perineal massage with our pelvic floor wand. So essentially perineal massage is something that you do from 34 weeks gestation during pregnancy to stretch the opening of the vagina and also the pelvic floor muscles very superficially and deep. This can help prevent severe perineal trauma, so a third or a fourth degree tear, as well as potentially increase or decrease rather the amount of time it takes you to push, so your second stage of labour, which may then decrease your risk of instruments, etc., etc. So what you'll need is basically a pelvic floor wand, some water-based lubricant, so our Bien Intimate Gel, and then a bunch of pillows propped up on your bed because obviously you've got a big belly and it's a little bit harder to reach. My position of choice when I was pregnant was propped up like this, but you can also do it in side lying, so I'll show you both options. We're essentially getting the pelvic floor wand, we're lubing it up from the tip all the way to the neck, and our aim is to stretch through this part of the pelvic floor and the adjacent tissue surrounding. So entrance of the vagina, we're aiming to stretch down towards the anus and then out kind of towards 3 o'clock and towards 6 o'clock. We're going to do a couple of different variations where we're either holding the stretch or moving with the stretch. We also want to get a little bit of this deeper layer of the pelvic floor. So this space is called the levator hiatus. That's the space bub essentially needs to stretch and move through in the pelvis. So we want the wand deep enough that we're also stretching through this layer, but really most of the stretch and most of that stingy burning feeling is going to be from the skin and the superficial pelvic floor. So you set yourself up, maybe you've done a little bit of mobility, maybe you've done some breath work, which you can find in another video. We've got our wand, we've lubricated it up to at least the neck of the wand. So you've set yourself up, we want to part the labia, and then the wand is going to go with the neck facing down into the entrance of the vagina, around 4 to 5 centimeters inside, so around that much, so you can just see the bend of the neck, maybe a little bit further if you want to, but you don't need to go that far in because we're working quite superficially. So the wand's sitting through there. Deep breath in, deep breath out. And then just notice, first of all, if you pull down towards the anus, how that feels. So we're aiming for kind of like a 3 or a 4 in discomfort. So pull down, deep breath in, deep breath out, deep breath in, deep breath out. If that's kind of like a 2 or 3, let's put a little bit more pressure down towards the anus and let's hold that pressure there. So holding pressure down, let's take 3 deep breaths. Ready, go. Keep that pressure. Rising into the belly. Let it go. And on the next inhale, really think about expanding through the pelvic floor. So open. And then exhale, gently recoil and tighten the pelvic floor just a little bit. Exhale, tighten. Now on your next inhale, think about pushing a little bit and open the pelvic floor. Keep that pressure there with the pelvic floor wand. Inhale, expand, and then exhale, recoil a little bit. So you might do that 5 times, and we're essentially doing a contract, relax, stretch. So as you contract the pelvic floor up, you're keeping that pressure on the pelvic floor, so it'll be a little bit of a firmer stretch. As you inhale and let the pelvic floor go, keep the pressure on the pelvic floor wand, or if you're feeling okay, increase that stretch. So that's more of a static hold, and we're just focusing that down towards the rectum. You could then do the same thing out on 2 different degrees of angle to the left, and then the same thing on 2 different degrees of angle on the right. So holding pressure still down, but then out to one side. Deep breath in. Exhale, little squeeze of pelvic floor, tighten around the entrance. Keep that pressure. Inhale, either increase the pressure on the wand or keep it the same. Exhale as you squeeze and you recoil. Inhale, we let it go. So you're working through that more static stretch. The next type of stretch we can do for perineal massage is movement. So we pull down towards the anus and come across. We then pull down towards the anus and come back. So you're kind of moving and stretching. So think of like a massage where you're moving through tissue. And with the breath, we might go inhale, exhale, just stay still. On your next inhale, really think about opening and move the wand. So inhale, exhale. Inhale, we go back towards the center. Exhale, stay still. Inhale, other side. And exhale, stay still. And inhale, come back. So you can be really quite purposeful with the breath and with the pelvic floor wand. That's all focused around the entrance of the vagina. You might do 5-10 minutes of this, depending on how far into perineal massage you've done. So, is this your first session or is this your 10th session before you move on? That might feel like enough around the entrance. You might be feeling like quite a significant stretch. The more times you do it and the further into your pregnancy you get, the more stretch you can apply to the pelvic floor and the tissue, because your hormones will be making it more elastic anyway. And then you've obviously done perineal massage a number of times. If you also want to, you can also work through the deep part of the pelvic floor. So we can then work through these deeper muscles, which I'll show you on this model instead. It's a little bit easier to see. So we work through these lateral structures of the pelvic floor. We're also potentially stretching and opening tissue that's adjacent to the part where the baby has to come through. So the more mobile and flexible and, the more movement you've got through your pelvic floor, essentially the easier it is for the pelvic floor to open and for bub to pass through. So if you're wanting to work the deeper layer of the pelvic floor, which is now less perineal massage and more just pelvic floor release, the wand would go in a very similar way, and then we would essentially turn it towards one side and pull it up towards your belly button. So the movement would be in, across, and then up towards the belly button, because that's going to get it on your pelvic floor. If you're kind of around this area, you'll just be in the vaginal canal kind of moving around, poking cervix and things like that. So we want it down towards the bottom and then tilt it across, up towards belly button. And that will really get you on that deeper layer of the pelvic floor. So when I'm doing pelvic floor release, I normally like to go in, again, a couple of deep breaths, move it across. Normally you can find a tender spot out to the left or the right side. And then sometimes I like to do a little bit of movement with my leg, a couple of deep breaths into anywhere that feels particularly tender. I might again do that contract, relax with my pelvic floor, just keeping constant pressure with the pelvic floor wand. You can play around with what feels good for you and your body. And if you can't find any particularly tender spots within the pelvic bowl or within that deeper layer of the pelvic floor, great, you can just move on and focus more so on that perineal massage. If perineal massage isn't comfortable reclined like this, you could also do it side lying. So if we're doing it side lying, get a bunch of pillows, pop it in between your knees, lying down like this, pelvic floor would be reflected like that. Sometimes it's just easier for reach. So if you're doing it like this, the wand at the entrance of the vagina, we're still angling it down towards the rectum, and then you'd be in this position where you can use the wand, so it's a little bit easier if I didn't have to hold the model as well. You can use the wand to angle it down and across like so. So you're kind of like reaching back to do it in this position. Another position that's commonly suggested and that works quite well is kind of with a leg up. And again, I would come from the back. So I would probably do it facing the other way because I'm right-handed. But you'd pop your leg up, say on a bath, a chair, your bed, something like that. Wand goes into the entrance of the vagina. So again, we're going in that way, pulling towards the rectum. And then you can still do your breathing, still do your stretching in that position. So it really just depends on what's gonna feel the best and be the most comfortable around your belly. So you can obviously get our intimate gel and our pelvic floor wand on our website. There's also more information about pelvic floor resources during pregnancy, postnatally, etc. So if you need that, you can head on across. Otherwise, I hope this video was helpful.